Hi everyone. So welcome to Wesley Pharmacy Services. And just to give you a quick intro, Wesley Pharmacy Services has been set up to inspire, empower, and enable you to live healthier. And we hope to ultimately change the health narratives for people with individual health challenges. And we hope to do that by being innovative in our approach, by tackling health inequalities and being holistic in terms of the approach that we take. So, today I want to talk about personalized medicine and the concept of personalized medicine as an alternative solution to individual health challenges. But before I go into that, I just want to talk a little bit about individual health challenges that many of us face today, just to give a bit of background and context to what I'm going to talk about as we move forward. So, most of us that have a health challenge today will probably fall into one of these categories. So, we may have a long term disease that could include a variety of things, but more commonly, it may include something like diabetes, hypertension, HIV, cancer. There's a long list of long term diseases. A lot of the principles for dealing with those long term diseases are very similar. Then musculoskeletal disorders. Not just this doesn't just relate to athletes or sporting people, it also relates to others that may be in jobs like caring for people, heavy lifting, physical jobs where there's a lot of heavy lifting and manual work, even for those people that do a lot of office job or on their computers a lot, that can also lead to injuries in your joints, your tendons, etc. So, if care is not taken, that can lead to things like chronic pain or arthritis. Then you have mental health. Mental health is an interesting one because I think a lot of people think about it as people going around speaking to themselves or naked, but actually, it's more than that. A lot of us, and it creeps up on you. That's why I think mental health can be a bit dangerous because oftentimes it will creep up on us and we realize a bit late the impact it's had on our physical health. So if you're continually getting stressed, you're likely to be more prone to things like hypertension, but not just hypertension. We also know that poor mental health is linked to many other long term diseases. So it's important to be intentional about taking care of our mental health and well-being and making sure we're conscious and aware of when we're in a heightened state of anxiety or when we have a low mood, and we try to do things to maintain the balance and to maintain our mental health and well-being. Then there's a lot of people that face sexual health and reproductive challenges. When I talk about sexual health, I don't just mean porn, because I know a lot of people think porn when they think sexual health challenges, but there are a lot of other things that come into play when we think about our sexual health and well-being, and also reproductive health. A lot of us are having babies older, which comes with higher risk of pregnancy complications, delivery complications, etc. And also, you have obviously, women with period issues, period problems, those are constant. So, and then unhealthy exposures. And if we don't deal with all these health challenges effectively, then it means that we either die before our time or we age in an unhealthy way. Now, we're all going to get older. The question is how we age. I look at, when I look at my family and remember my grandparents' generation, I saw them dying of old age, like they lived full lives and they were still strong in their old age. Like my grandmom always woke up by 5, which is probably why I find it hard to sleep late because I'm used to waking up early. And but I don't see that in my parents' generation. I see them dying a lot earlier, and I see them getting a lot of long-term diseases at an earlier age than I feel they should. So I want to change things for the generation after them. And we can only do that by addressing these health challenges. So, it's obvious, like I said, these are the health challenges we're facing, and the current system, though it's effective in some ways, I believe we need an alternative. And it doesn't mean we do away with what we already have that works, but it means that we need an alternative way to ensure that um, individuals can overcome individual health challenges, regardless of what their health challenge may be, and regardless of what community they're from. And, there are, just as I've said, some of the barriers, there's a lot of barriers in the system that mean that even for the solutions we have, we're not able to use it as effectively as we would like, and not everyone is able to access it. And this, for example, there are policies that look great on paper, but when it comes to implementing them, it's a challenge. Then there's the prevention. We don't spend enough, even though we all know prevention is better than cure. A good example is the UK, which only spends 6% of its budget on prevention. So we spend loads more money on trying to fix people when they have a disease than we do in trying to stop them from getting a disease. Third world countries like Nigeria, it's even worse. Only 2 grand is spent per person by the government per annum on health. That can't even buy, that's £2, by the way, in pounds. That can't even buy a course of medicines for a month. And so many other issues that really mean that we need an alternative. So, what might the alternative be? I think so. I'm going to talk now very briefly about personalized medicine. Um, so, this is an emerging thing that there seems to be a lot more momentum about it at the moment. So personalized medicine is really about targeting healthcare interventions and treatments at people based on their individual characteristics. So it's about delivering health interventions in an individualized manner, um, to based on individual characteristics. A key component of it is pharmacogenetics, and I think in a lot of research going on in this field, and I think a bit more of it is skewed towards pharmacogenetics. Pharmacogenetics is basically about using your genes to targeting treatments at you based on your genes, and that enables us to deliver personalized treatments that are more effective and with less side effects. And you see it a lot. It's not a new thing. Like I said, I did my final year project at uni in this, and that was many years ago. And obviously, things have moved on since then. So we have more drugs coming out that where we are able to test patients and identify what drugs might be more effective and might give people less risk of side effects. And you see it a lot in things like HIV, cancer. We use a lot of it, and there are more drugs coming out with that. So, personalized medicine also enables us to diagnose more effectively and more accurately. And it also enables us to predict and prevent diseases more effectively, which ultimately enables people to achieve health related goals more easily. So it's a great concept, and it's something that is taking momentum. And there is actually an international collaboration of countries that are working on this. Most of the research to date has been done in the US and Europe. And they're pushing, they have a vision, this international collaboration have a vision that personalized medicine will produce more informed and empowered individuals. Also, healthcare systems will be able to deliver health interventions, whether in terms of preventing disease, diagnosing disease, or treating diseases more effectively through individualizing their approaches. Um, so it's a great concept with the potential for a great impact, but we do need to consider some of the barriers and do need to start thinking about whether or not we really need to wait till 2030 before we can start to realize some of this. I personally don't think we do, because I do think there's a lot of research out there already that can enable us to achieve some of these things without waiting for the government to get its act together to bring it to reality. So one of the things that I don't think um, the concept considers at the moment is the issue of non-compliance. So there's a lot of medicines, a lot of healthcare interventions we already have that people don't get the full benefits just because they don't comply. They don't do as they're told. They don't take the medicine. And the reasons for these are multifactorial. We do know that majority of people, 80%, give up on achieving their health goal by month 3 of the year. less than 10% achieve their health goals every year. And we need to consider all these things and why people are struggling to achieve their health goals. And that's because of many different reasons. But key reasons include the fact that some people lack commitment. For some people, they lose the motivation. Some people try to apply general information to their own individual scenario, which is kind of like impossible, because like we talk about personalized medicine, everybody's an individual. Your health your health is based on your individual circumstances, and therefore any solutions to your individual health challenges has to be um, delivered in an individualized manner in order to be more sure of getting results. Unfortunately, these are things that aren't often considered, but these are things that I do think needs to be considered in any healthcare intervention or program. So the question is there an existing alternative, or can we create an existing a solution that actually applies these concepts today, without waiting for the government? And I think we can, but I do think that any such solutions will need to consider um, these things here on this slide. So any existing solution will need to be tailored and holistic, will need to be informative in a way that educates people with information that is relevant to them as an individual and their community, that empowers individuals, and obviously must be affordable at an individual level. I don't think we can rely on government alone, but I think if we consider all these three things in our approach, then we will inspire, empower, and enable individuals and communities to live much healthier lives. Um, so, um, what might be the answer? So, we really believe we've created an innovative health improvement program that we believe is unique, is innovative, and is tried and tested. What do I mean when I say it's tried and tested? In that I did a series not too long ago on the biblical principles for health challenges. Biblical principles, in my opinion, are universal principles. They are what they are. If you abide by them, you are guaranteed results. We have considered that and consider that in delivering our program. I've spoken a lot today about the concept of personalized medicine. And although we may not be testing people's genetics, there are a lot of other principles and concepts um, we have considered and tried to apply that we know that work, and we know it's cost effective. There's a lot of research that shows that it's a very cost effective approach, and we've considered that in creating our health improvement program. And for anybody that knows us, knows that WESI is the Women Elite Sports Empowerment Initiative. The parent organization has been organizing various sports events for young women, delivering health and social empowerment initiatives, mentoring coaches. And we're mentoring coaches to be champions in their sport, but also in their communities, and to raise other champions. And we've done that consistently over the last decade because we've applied some key sporting principles, and we've taken some of those principles and considered it in creating this health program. And it's an authentic program. It's not government funded. It's something that has evolved organically over time through our experiences, as well as my professional experiences as a pharmacist and as an advanced care practitioner. So what does a program what are the key benefits? So it's about preventing disease. And when I say preventing disease, I mean preventing you from getting a disease, preventing you, if you have a disease, from it getting worse or from you developing complications, and in some case, trying to reverse a disease. It's also about the safe and effective use of medicines. I try not to talk individually about medicines on a general basis, because I do believe using medicines effectively and safely is about taking an individualized approach. So what I might tell you about this medicine and how to use it might be different from the next person, but ultimately it's about making sure that you can achieve your personal goal within the context of your own challenges and the scenario that you face. And then it's easily accessible and affordable. So wherever you are on the globe, it's a virtual program, so you can easily access it. what does the program entail? So there are 5 parts. There's the online course where we talk about the African diet, which is a great tool, but I don't think the way we use the tool has evolved with time. So it's about getting the best of our diet. Then there's a health book where we try to join the dots and give everyone a very good foundation on general health and well-being. And then there's a health consultation to address specific healthcare needs and help you identify priority goals. And we also provide a personalized health plan where we give tailored advice on diet, herbs, medications, lifestyle, and supplements. And that all that is delivered alongside education and inspirational videos. So that's what the program entails. And there are 3 packages, which is the bronze package, which is just the online course, the silver package, which is the online course, the health manual, and the health consultation. Then you have the gold package, which includes everything in the silver package with that personalized health plan we spoke about before. And obviously, for all 3, you get access to our educational and inspirational videos. Now, it's a prices start at an affordable £120 or equivalent in other currencies. And that, ladies and gentlemen, bring me to an end of this video. Thank you for listening. I hope that you found it informative and useful. When I come back, the next video will be to do with weight loss. Please, please, please don't forget to share, let's be our brother's keeper and spread the word, and subscribe to our channel in order to get more free, healthy, and inspirational videos. Thank you for listening. God bless. Till next time. Bye.